Hello and welcome to today's live chat about COVID-19 and the heart and blood vessels. Thank you for joining us. My name is Ed Bottomley with the Michigan Medicine Department of Communication, and I'll be your host for today's chat, which we are doing remotely, so excuse any interruptions. We're joined today by Dr. Nicole Bhave and Dr. Geoffrey Barnes from the Michigan Medicine Frankel Cardiovascular Center. We'll move on to our questions for our panelists in a moment. But first, just a few housekeeping items. You can submit questions at any time for our panelists to answer during today's chat, even now. Questions can be submitted by commenting on this video, but please note that if you do so, your name or your profile name will be visible to others participating. Now, if you prefer a more anonymous option, you could also send us a private message via Facebook, or you can email us at ask-mishmed@med.umich.edu. Now, I have to read that off because I can't memorize it, so I'll read that one more time. ask-mishmed@med.umich.edu, and that email inbox will be monitored too. If you can't stay for the whole chat, or you want to share the recording with a friend, a video of the chat in its entirety will be available on our Michigan Medicine, our Frankel Cardiovascular Center Facebook pages, and our Michigan Medicine and Frankel CVC Twitter accounts. It will also be posted on the Michigan Medicine YouTube channel for you to have a look at too. Next step, let's have our experts introduce themselves. First up, welcome Dr. Bhave.
Thank you. It's a pleasure to be here. So good afternoon, everyone. I'm Dr. Nicole Bhave. I'm a cardiologist and cardiac imaging specialist here at Michigan Medicine and also at the Ann Arbor VA.
Fantastic. And welcome to you, Dr. Barnes.
Hey, thank you so much for having me. I'm Geoff Barnes. I'm a cardiologist and a vascular medicine specialist here at the Frankel Cardiovascular Center, and I'm really excited to participate in today's discussion.
Well, it's great to have both of you here with us. So let's jump into today's topic. Questions for COVID and the heart. The first question we have up is, what are the biggest topics of discussion in the cardiovascular community right now related to the COVID-19 pandemic that you want to discuss today? And I'll push that first to you, Dr. Bhave.
So the answer to that question has really evolved quite a bit over time, I would say. So one thing that we're still trying to understand is the diverse spectrum of ways in which COVID can affect the heart, not only during the acute illness, but also during the recovery period. We're still learning the best ways to use cardiac imaging in order to figure out what's happening with the heart and in order to follow patients over time. And then I think a question that's on everyone's mind is, are vaccines appropriate for everyone? Is one vaccine better than another? Are higher risk patients better off with one vaccine or another? So that's something that I think we should definitely discuss today. Dr. Barnes, did you want to add to that?
Yeah, Dr. Bhave, those are some really great questions. And I would agree, those are a lot of things I'm hearing about from my patients and my colleagues. For me, I tend to specialize in problems people have in blood vessels outside of the heart. So I hear a lot about those concerns as well. Am I gonna get a blood clot if I get COVID or if I take the COVID vaccine? If I do have a blood clot, what am I supposed to do to treat it, or how can we prevent it? If I take blood thinners for one reason, is it safe to get the vaccine, or what's that gonna mean for me if I get COVID? And so those are a lot of the questions that I tend to hear from my patients and that my colleagues and I are discussing, and I'm sure we'll get into many of those today.
I think we will. In fact, we might get into them very soon. The next question that I have up, as a vascular medicine specialist, Dr. Barnes, can you talk about blood clots and COVID-19? How significant is the risk of blood clots for people with a COVID-19 infection?
Yeah, Ed, that is a really great question. And the answer is we're still trying to figure that out. Just remember, it's only been 1 year since we've even learned about COVID-19. And we've had to sort of learn so much about not just COVID-19, but all the other ways that it affects the body. What I tell my patients right now is there is definitely a link between people who have COVID-19 and are sick enough to be in the hospital and developing blood clots. Our best guess is that somewhere around maybe 1 in 4 patients who are sick enough to be in the hospital may be at risk of getting a blood clot if they have COVID-19. And that's why we're all working really hard to make sure that they get the appropriate medicines to try and prevent those blood clots from forming. But I think we're going to continue to learn more as bigger studies come out and we get a better handle of exactly who's at risk and how big that risk is. But right now, that's probably our best guess.
And we have a series of follow-on questions for you about that. The next one that I have up, why might someone who gets COVID-19 be at risk for developing blood clots?
Yeah, and there are a number of reasons. You know, people tend to get blood clots when certain things all come together at one point. Often these are people who are feeling ill, so they're not moving around a lot. Their blood's not circulating because they may not be walking. You know, if they're in the hospital, we put them in a bed and we tell them not to move around. So the blood's just not circulating as much, and that might put them at risk for developing a clot. At the same time, they're not feeling well. You know, you feel run down, you feel, ill. You may not be drinking as many fluids and you get dehydrated, and that can certainly contribute to getting blood clots. And then beyond that, there seems to be something really special about this virus that revs up the body's immune system. And we get this cytokine storm. You may have read about that in the news. It's basically the body's immune system sort of going into overdrive. And we know there's a strong connection between inflammation or the immune system sort of going crazy and people developing blood clots. And so there's probably a link there as well. So when all three of these factors come together, that seems to be sort of the perfect milieu or the perfect setup for somebody to develop a blood clot.
Oh, absolutely. The next question we have up for you, should people who develop COVID-19 but are well enough to be at home do anything in particular to prevent blood clots?
That is a great question that I hear a lot. And right now, the data would tell us that the risk of getting a blood clot in somebody who has COVID-19 but is well enough to stay at home is probably pretty low. So I'm not recommending that those patients take any sorts of medicine specifically to prevent a blood clot. What I do say is make sure you stay well hydrated. Make sure you try and move around as best you can. Even if you're just confining yourself to your room, doing some walking, moving around, trying not to lay in bed all day. Those are some of the most important things you can do to try and prevent a blood clot. We really are reserving medicines for people who get a little bit more ill and then require a stay in the hospital.
Absolutely. The next question that we have up, what should people who have previously had a blood clot before or are taking blood thinners know if they developed COVID-19?
Yeah, the most important thing is if you have a history of blood clots, you're in that group that's more likely to get a blood clot in the future. And certainly if you're on a blood thinner, there's something about you that we're concerned that blood clots could form for any number of reasons. So for those people, it's really important to continue taking your blood thinner, whatever it is, and make sure that you're staying on top of that. If you're somebody who's supposed to take a blood thinner every day, make sure that you're not skipping your doses. If you're somebody who takes warfarin, or also known as Coumadin, make sure you continue to get your INRs checked and that you're in touch with the nurse or pharmacist who helps you manage that so that we can be sure that you're getting the safest and most effective treatments possible. So continue taking your therapy. And if you can't because you're too ill, make sure you're reaching out and talking to your doctor so that we're aware and we can help you with that.
Thank you. The next question, this is a topic that's got a lot of headlines this week. Should we be concerned about the reports of blood clots related to COVID-19 vaccines, including the AstraZeneca vaccine?
Yeah, so there's a number of important points to make here. And the first is that this can be really scary, right? Taking a vaccine to try and prevent COVID-19, are we concerned that we may get blood clots? And I can understand why people get really concerned about that. But I want to give you some important information and hopefully reassure you why I think these vaccines are really safe. So the first thing I'll say is that most of these reports are related to the AstraZeneca vaccine, which currently is not available in the United States. So if you're in the United States looking to get a vaccine, that's not one of the ones that you have to worry about. But even beyond that, remember that millions of people in the European Union have received this vaccine. At the same time, remember that getting a blood clot is actually pretty common. And so it's not surprising that when you vaccinate 5 or 6 million people, some of them are going to get a blood clot, and they would have gotten that blood clot anyway. This is a coincidental sort of finding. In fact, when we've looked at the numbers, at least the reports in the news media, the rate of people getting blood clots that they are reporting after a vaccine is actually lower than what we would expect if you just looked at the general population. So many leading experts, myself included, and a number of other leading societies have really tried to reassure the public that there does not seem to be a strong connection between the vaccines and developing blood clots, that it is very safe to get these vaccines, and it is a high priority, not just for your individual health, but also to help protect all those loved ones around you. And so we would encourage people to continue getting the vaccine whenever it's offered and available to them.
You know, the first thing that you really said about this when we talked about this topic was new research coming in, was data that's becoming available. What research is happening in this area, and what do you still want to know to be able to best care for and advise your patients?
Oh boy, there is a lot of research going on. You know, I have colleagues who do basic science research who are trying to understand exactly why this virus seems to cause people to develop blood clots. What are the mechanisms that's really going on there, so that we can understand how to target our treatments better? And there's a ton of people doing a really good research there. There are also a number of people who are trying to understand population risks. So when we look at large groups of people who have COVID-19, what are some of the adverse events or the bad things that happen to them, and how can we understand risk? And then there's a third group of people who are trying to really figure out what are the best treatments. And right now, in the sort of the blood clot space, there's a lot going on. People are being enrolled in different randomized trials where we're testing different types of blood thinners, or maybe different levels of blood thinners, to see whether that will help us prevent blood clots and make people better when they have COVID-19. We're learning a lot, but there's a whole bunch more to learn. And I think in the next 3 or 4 months, we're going to learn even more about how to effectively and safely treat patients to prevent some of these complications.
Thank you. Thank you so much for those answers. Next up, we're going to move on to you, Dr. Bhave. The first question we have here, it's almost a two-parter here. Do we know yet about the long-term effects of COVID-19 on the heart? And does having a COVID-19 infection damage your heart?
So those are both excellent questions, and I think we still have a lot to learn regarding the answers to both of them. With regard to the long-term effects of COVID-19 on the heart, you've probably heard about long hauler syndrome, and we're still really trying to wrap our heads around what causes that and what exactly it means. But it's clear that there are many people who, for weeks to months after an acute COVID-19 infection, they will have symptoms including extreme fatigue, exercise intolerance, or the inability to exert themselves at a higher level, palpitations or rapid heart rate that don't really seem to make sense or fit with activity level, as well as dizziness and problems with lightheadedness when standing up. And this kind of mirrors a syndrome that we talk about in the cardiology community called postural orthostasis and tachycardia syndrome, which honestly, that is in and of itself a huge and very murky topic, and one that can be very difficult to treat. And so what I'm telling my patients is, you know, it may take you weeks to months to really feel back to your normal self after you have COVID, even if you haven't been in the hospital. What I'm recommending to people is that if you're feeling your heart racing or pounding in ways that seem way out of proportion to your activity level, or if you're not feeling that your overall symptomatology is gradually getting better, that you're not able to walk a little farther and do a little bit more each week after COVID, those are reasons to talk to your doctor and think about whether it makes sense to do any heart testing or further workup.
Absolutely. So is there any relationship between COVID-19 and heart attacks?
Yeah, so there are different ways in which COVID can cause what we call myocardial injury or injury to the heart. And if you are reading the newspaper these days, you may have seen some papers on a blood test called troponin, which is a protein that's made in the heart that can get released into the bloodstream in any condition in which the heart muscle is damaged. And a situation we very commonly use that test in is in heart attack. And what we mean by heart attack specifically is when there's a sudden complete block, often complete blockage of a blood vessel. And that's something that unfortunately is an extremely common problem in this country, irrespective of COVID. So that's one way in which COVID can precipitate heart muscle damage. And sometimes that's through an actual clot forming in the blood vessel. But there are other ways that COVID can do that too. As Dr. Barnes was mentioning, this sort of cytokine storm, all these inflammatory issues can directly hurt the heart muscle. And there may be a very small percentage of patients in whom the heart muscle is actually infected with the virus, but we think that that's an incredibly small number of people. So lots of different ways in which COVID can impact the heart.
Yeah, and you touched on palpitations, things like that earlier. What about the relationship between COVID-19 and heart palpitations, irregular heartbeats, perhaps heart valve disease?
Right. So when we say palpitations, that term just means an awareness of your heartbeat. And that can be in a normal rhythm or an abnormal rhythm. And honestly, much of the time when we see people in the office for that problem, there's not actually an arrhythmia or an abnormal rhythm. It could just be that they're aware of their heartbeat. They may just be sort of body aware people, as some of us are. I happen to be one of those people myself. Other times it could just mean that they have a rapid heartbeat, but the rhythm is normal. And then sometimes it's an indication of a serious heart rhythm issue. We know that, as I mentioned, some people with like long hauler type of symptoms will have faster heart rates for reasons that aren't entirely clear. But we also know that systemic illnesses like COVID can make people more susceptible to other heart rhythm problems. One of those is a problem called atrial fibrillation, which is the most common rhythm problem that we see in this country. It's more common in people as they get older, people who have underlying conditions like high blood pressure, and any medical illness can really trigger that. And so I've taken care of a couple of patients who, when they were in the hospital for COVID, they had their first diagnosis of AFib. And that rhythm can go very fast, and it can also increase stroke risk. So it's extremely important to recognize that and treat it if it's present.
Thank you. The next question that we have up is an interesting one. Are there any cardiovascular conditions that would make you recommend against a COVID vaccine? Do any of the vaccines affect the heart?
No, I can't think of any. In fact, I would argue the opposite. People who have heart disease are really at risk for complications from COVID. And so they're some of the people who I would most strongly recommend get the vaccine. So I can't think of anything where I would tell a patient not to get the vaccine. Obviously, if they have a concern, they can always reach out and ask their doctor, but nothing's jumping to my mind. I don't know, Dr. Bhave, if anything triggers for you.
Yeah, I agree with that. And even I touch base with a couple of my colleagues who take care of some of our transplant patients who have compromised immune systems from medications that they take to protect their transplanted heart or kidney. And essentially, our group is recommending that patients should take whatever vaccine is available to them as soon as it is, because they're all extremely effective at preventing hospitalization and death. And so it's one of those situations where a bird in the hand is worth two in the bush. People do often ask me, what's my risk of severe COVID in the setting of my particular cadre of heart conditions. It's clear that underlying conditions like hypertension and diabetes are associated with higher risk, but if those are well-controlled conditions and you haven't been in the hospital and you've been stable taking your medicines, then your risk is probably only slightly higher than other people in your age group. But if you've had a lot of hospitalizations, if you have congestive heart failure and you've had a lot of problems with that, and multiple other medical problems on top of each other, then you probably are at higher risk, and it's even more important for you to be vaccinated in a timely manner.
Thank you for that. The next question we have up, I'm going to push this to you, Dr. Bhave. There has been a lot of discussion in the medical community about heart imaging related to COVID-19. Who should have heart testing during or after COVID-19 infection, and what kinds of imaging are useful?
Right. So at the beginning of the pandemic, when we were short on personal protective equipment and we didn't have vaccines available, as all of you know, we really tried to limit unnecessary testing unless we really felt the test would really improve or affect a patient's care. And so we were extremely, and we still are thoughtful, but we were at that point we were extremely thoughtful about when should we be doing an ultrasound of the heart or echocardiogram. And I as an echocardiographer, I triage these decisions every single day. Most, let's not forget that primarily this is a respiratory illness. So there will be many patients who have low oxygen levels, high heart rates because of the respiratory infection. But if there are other markers that suggest that there's something else going on with the heart, meaning that blood troponin level is elevated, they have a lot of swelling in their legs, they're having atrial fibrillation or other arrhythmias, those are people who may have a structural heart problem, and it probably is worthwhile to do an echo or ultrasound of the heart. And that's usually a bedside test. It's just an ultrasound probe on the heart. It's completely non-invasive and extremely safe, and usually we can get a ton of information about the heart function. As far as additional testing, there's been a lot of press about cardiac MRI and what that can tell us about what COVID's doing to the heart. And I would say we're still really trying to learn. So there's a contrast agent that can be given through the IV, gadolinium-based contrast, and that will light up the heart muscle in different places that are inflamed or swollen. But sometimes it's really hard to know what to do with that information. So if you have a little bit of what we call late gadolinium enhancement on an MRI, what does that mean about your long-term prognosis? We're really still learning about that, and I'm definitely not recommending routine MRIs. I would only recommend an MRI if a patient has a major abnormality on echo, if they're having a lot of symptoms that we really just can't explain with the other data that we have, or if the troponin level is severely elevated. So that would really be a very select group of patients who should go on to have that imaging test, in my opinion.
Thank you for that. Dr. Barnes, anything to add?
Well, I would actually ask a question of Dr. Bhave. You talked about a lot of the different imaging tests that we as cardiologists do. One question I hear from my patients sometime is, if I've had COVID-19, do I need to get some sort of an imaging test before I can go back to work or go back to exercising or any of that? And I'm wondering, how do you advise patients? Do they need to get an echo, or if they're feeling well and we think they're out of the infection period, are they okay to sort of slowly build back up? I'm curious what you advise them.
Yeah, that's a really interesting question, and it sort of overlaps with this return to activity question that we're also getting a lot in our office. So I would say for patients who are gradually beginning to feel better, who aren't having symptoms like chest pain or severe shortness of breath or a lot of heart racing issues, I would not recommend testing. One challenge of heart imaging is that anytime we find an abnormality, even if that's subtle, we have to figure out what are we going to do with that. So we have seen some young people, we've read imaging tests on their hearts and like, oh, one of the heart chambers looks a little bit big, or the heart muscle function looks kind of borderline, but maybe it was like that before they had COVID, and then we're just not really sure what to do with the information. So I think before we order a test, we really have to know like how we're going to use the results. And so I'm really emphasizing to patients and colleagues, like, don't order tests on asymptomatic patients unless there's, some other marked abnormality, like maybe a major EKG abnormality or something like that.
Thank you for that. And thank you for the question, Dr. Barnes. Dr. Bhave, the next question we have up for you. You're an expert on cardiovascular care for patients with kidney disease. How have you seen COVID-19 manifest in this group? And which patients with heart disease and kidney disease are at highest risk for severe COVID?
Yeah, that's an excellent question. So unfortunately, COVID has really disproportionately affected patients with kidney disease. And I think a large part of that is because patients with chronic kidney disease often have multiple other medical problems. The major causes of severe kidney disease in this country are diabetes and hypertension. And we know that both of those conditions also increase risk of severe COVID. And unfortunately, the reason that I do what I do is that chronic kidney disease and cardiovascular disease often go hand in hand. And kidney disease can accelerate and worsen heart conditions, including congestive heart failure, coronary artery disease, and also valve disease. We know that patients who are dependent on dialysis are especially vulnerable to severe COVID. Unfortunately, the mortality rate, the death rate in that population is around 20%, which is truly tragic. And I have to give extreme props to my colleagues in nephrology and also the staff at dialysis centers who have had to be extremely careful to work to isolate COVID positive patients to protect everyone, because even if a patient's COVID positive, they still have to have their dialysis care. Dialysis is truly a lifeline for these patients. So that's been a major challenge that the medical community has had to rise to. We also know that COVID itself can cause kidney injury, and many patients who require dialysis while they're in the hospital will go on to require outpatient dialysis. So that's been an even larger burden on outpatient dialysis centers as well. And as to why COVID causes kidney injury, there are probably multiple mechanisms, just like there are for heart damage. So there's the inflammatory issues, there's damage to the blood vessels, volume shifts, like congestive heart failure, fluid backing up from a weakened heart. And then, of course, medications can also damage the kidneys. So multiple reasons for the kidneys to be affected by COVID. And a lot of the patients who I take care of either are pre or post kidney transplant. And as I was mentioning before, patients who have had a transplant are on immunosuppressive medications, and they're therefore at higher risk of severe COVID. So particularly when I see my dialysis patients and also my post-kidney transplant patients in the office, I'm encouraging them to be extremely careful. So not only to seek out vaccination as soon as reasonably possible, but also to take all the precautions that you would even during like regular old flu season. So try not to go into large crowds, really make sure to be careful about hand hygiene, mask whenever you're outside your own home. And then also just keep in touch with your regular care team and let them know if there are changes in how you're feeling, because oftentimes, our patients with heart failure, kidney disease, if they get a little bit volume overloaded, they have a little bit of fluid in their legs, then they can end up in real trouble and land in the hospital. And we want to do everything we can to prevent that.
Absolutely. Dr. Barnes, I see you're unmuted.
Yeah, I would just add to what Dr. Bhave mentioned, that for many patients who have kidney disease, especially those who have severe forms of kidney disease, they require dialysis. And if they're admitted to the hospital and we're giving them dialysis, those patients are at particularly high risk of developing blood clots. And in fact, they often will have problems where the dialysis machine that they're used to using will clot off. And it's created a lot of challenges in how to safely manage the kidney function for these patients. So this is really a unique sort of combination of problems that, it takes a lot of specialists to come together and try and manage, but it's all the more reason that patients who have any form of kidney disease really need to be diligent about staying safe, hand hygiene, wearing their masks, getting their vaccines, all those sorts of things.
Yeah, and there was a period of time, I would say, particularly earlier in the pandemic, where I had patients who were afraid even to come into the lab for a simple blood draw. But I would say, listen, I need to know what your kidney function is so I can dose your medication. So I think fortunately, a lot of that fear has gone away now that more people are vaccinated and we're kind of all just more used to all of this. But I would say, definitely don't miss appointments, don't skip blood draws, make sure you take your medicines, really consistently.
Yeah, that's very interesting, because that's really our next topic of discussion. Some of the other effects of COVID-19 on cardiovascular care and cardiovascular health. And my next question for both of you is, what is your take on the switch to more reliance on telemedicine, and how has that gone in your clinics?
Well, I'm happy to start. It has been really just a dramatic shift. If you think about the few number of visits that we did with patients over a video or phone before COVID-19, to that becoming really the predominant way we interacted with patients in the spring when COVID started, to now it is just a routine part of my clinic. I might have a day where half the patients that I see are through the Zoom calls or over the phone rather than in person. And I think there have been some really great advantages from this. First off, I see a lot of patients who have to travel really far to come and see me, and they can save hours of travel time by just calling in on a Zoom call. And that's great. I love being able to make it more convenient for them. Sometimes it also makes it easier. Other family members can be around to help hear what we're talking about, share more of the story. Those are really some great advantages of being able to do this from home. But it also has some downsides too, right? The technology is not the easiest for everyone to use. Sometimes we can't figure out how to get the microphone to work or the camera to work. And sometimes it's important that I can do a really good physical exam. If I can't actually listen to your heartbeat or do a really good blood pressure to understand where that's at. I see a lot of patients where I need to look at their legs and understand how much swelling is there and what their skin looks like. Some of that we're just not yet good at doing over the camera. And so I'll tell a patient, it's really in your best interest to come and see me in the office. But for so many other visits, we can do this great. We can talk about the benefits and the risks of different therapies. We can order tests, refill meds, all that sort of stuff. So I think it's been a net positive, and we're just going to continue to get better at this as everyone figures out who can do a good phone call visit and a video visit and how to do that effectively.
I would echo everything that you said. I mean, for me, telemedicine and the increase in telemedicine in my practice has really been one of the silver linings of the pandemic. I think it's way more convenient for a lot of patients, and it's sort of a different way of connecting. I find sometimes when I'm on a Zoom call with a patient, I'm really just focused on that conversation. I don't have anybody knocking on the door to distract me to look at things or be pulled in different directions. I can really just focus on my patient. So I really like that. Of course, the not being able to do a full physical exam is a potential downside, and oftentimes when people come into the office for an appointment, we do other testing like an echo, and we can't do that virtually. But I think virtual medicine is a really nice way, particularly for patients with stable conditions that they can monitor well themselves at home. I think it's wonderful. Like if I'm seeing you for follow-up because you had a heart attack a few years ago, but you're taking your medicines and you're not really having chest pain, and we're just kind of doing a maintenance check-in. I think it's a great way to do that. And what I've been doing with a lot of my long-term patients is kind of alternating between in-person and virtual visits.
Fantastic. The next question that we have up related to this, at the beginning of the pandemic, you saw people delaying care for emergencies. Can you talk about that and whether it's still an issue today?
I personally think that there are definitely a few patients who are apprehensive about coming in. I think there's a little bit less trepidation about short visits, like for blood draws and quick office visits. But I have some patients who, one of the common procedures we perform here at our center is ablation for atrial fibrillation. We have a very high volume center for that procedure. And that's a procedure where you could be admitted for a couple of days to the hospital. And I've had a couple patients say, you know what, I'm not feeling badly enough that I want to do this right now. Why don't we just hold off for a few months? So there is some of that. But I think the fear is a lot less dramatic than it was at the beginning of everything. And what I was telling people, so at the beginning, like March, we didn't really have the capability to test every single person when they came into the hospital, but now patients are tested before they're admitted, so we're able to cohort patients effectively and do our best to keep everyone as safe as possible.
Dr. Barnes?
Yeah, I agree. I think that I still find some patients who are apprehensive, or when given sort of the option for maybe a less critical treatment or visit, they're opting to say, I'll delay. But the thing I try to reassure them is, vaccination has been widespread within the healthcare provider community. And that's not just the doctors or nurses, but it's really our entire system that we have been very aggressive in getting vaccines to. And so there's a layer of protection there. We also now have 12 months of experience on how do we make sure that we're keeping you as a patient and us as the healthcare professionals safe, and what kinds of masks are most appropriate and what kinds of gowns and how do we separate people and all those sorts of things. And so I think we've learned a lot. We've created processes that make it safer for patients to get the care that they need. And so I really feel very confident in coming into work every day and bringing patients in when they need to come in for different tests or procedures. And I try and reassure them of that.
Thank you both for that. The next question, this is a little bit of a follow-on too. Do you have concerns about other health effects of our different pandemic routines, such as weight gain in the setting of a more sedentary lifestyle?
Yeah, definitely. So I think, particularly during the winter, I think a lot of, and we live in Michigan, so it's cold, and I feel like we see a lot of people revert to a more sedentary lifestyle anyway, and then the pandemic just sort of compounded that. So I'm really trying to encourage people to seek practical ways to increase their activity level and also limit the snacking, which, frankly, when you're home a lot, and, maybe not as entertained as you otherwise would be, it's a problem. And, maintaining a healthy weight for many people is really a daily struggle. Fortunately, we're getting into the springtime. I think more people are starting to get outside and walk, which is really great to see. And really just trying to make healthy choices with snacks. So, fruits and veggies, and kind of limiting the complex carbs and things like that. But yeah, it has been a challenge. And I think, unfortunately, a lot of people have gained a few pounds or more during this. But I have seen some of my patients lose some of that weight. So that's been exciting.
I'll just build on that. I think there's the obvious thing that we as cardiologists worry about, weight gain and blood pressure and all of that. But I think that the isolation, the social distancing that we've really needed to keep people safe has created a really significant psychological toll on people. It's, we are creatures of interaction, and we crave being with other people. That's just part of being human. And so when we're separated from that, and when that's inherently limited, it really creates a lot of stress for people. And I think that stress has manifested in different ways. And so I've certainly seen that in the patients I've talked to. When I think about my family and my friends and colleagues, that's certainly something that I've seen a lot of. And we're going to need to sort of think carefully about how we undo that and how we get people back into feeling comfortable, being safe, re-engaging in some of those social interactions, so that we can get back to those normal ways of interacting. And I think that's good for us just as people, let alone as sort of with regards to our heart and blood vessels and all those other issues.
Yeah, I think you're absolutely right. And I think for many people, one place that was a social outlet that kind of went away for a while was the gym or cardiac rehab. So unfortunately, our rehab facility had to close when our office at Domino Farms was closed for a couple of months. And then we reopened with very careful social distancing. And I think that was a real boon for many of our patients. And I'm telling people, if you're vaccinated and you're going to a gym where, unless you're very high risk and you have, you're immunocompromised or you have a lot of medical problems, if you're at baseline at pretty low risk for COVID, and you go to a gym where all the practices are in place, people are masking and social distancing and cleaning the equipment and using good hand hygiene, and you're vaccinated, I encourage people to go back and get to the gym.
Fantastic. The next question that we have up: what is ECMO, and why are we seeing news about it being used to help some people with a difficult case of COVID-19?
So ECMO is a type of support for some of our sickest patients who have extremely weakened heart muscles. And essentially, it's a machine that's run in our ICUs, our intensive care units, that does a lot of the heart's work for it. So if the heart can hardly pump blood on its own, the machine can both pump the blood and oxygenate in order to maintain blood flow to all the body's organs. And this is a resource that's only available in a few centers. And here at Michigan Medicine, some of our colleagues have saved lives with this technology.
Thank you for that. This next question for both of you is: as clinician scientists, what do you want people to know about COVID-19 prevention, vaccination, treatment? What's your bottom line advice to patients who want to know, what should I be doing?
I'm happy to start. I would say there are probably three messages that I would want to get out. And the first is that COVID-19 is real. And for patients who get COVID-19, the illness and the risk is something that is very real. And so we all have a responsibility to try and protect ourselves and our community from COVID-19 by doing the basic things: wearing a mask, hand hygiene, socially distancing when recommended by the public health authorities. And I think that's really important point number one. The second is that your health system is still here, and that we've put processes in place to make sure that the care you need can be done safely and effectively. And so if you're somebody who has a heart or blood vessel condition and you follow with one of the doctors here at Michigan Medicine or the Frankel Cardiovascular Center, we can help provide that care for you in a safe way. And so please continue to engage with us. And that the third is that the vaccine is really such a critical element to helping us get through this pandemic. And so we would encourage everyone who's eligible to get the vaccine. If you have questions or concerns, ask your doctor, but this is really an essential element of public health and helping us solve this pandemic crisis.
Thank you.
Yeah, I would echo everything that Dr. Barnes said, and I would encourage, as I mentioned earlier, I would encourage patients to obtain whatever vaccine is available to them as soon as reasonably possible, and that doesn't matter if you're young or if you're older, if you have chronic medical conditions or not. We know that, unfortunately, this virus can make even young, healthy people critically ill, and we want to do our best as a society to prevent that. And I think that, number one is vaccination, and then continuing to follow all the traditional public health measures like masking and social distancing.
Thank you both. We're coming to the end of our time, the end of our questions, but I always think it's so valuable to have experts like yourself on here. My last question is always, is there anything you think we've missed? Any topics you'd like to touch on?
No, I mean, this has really been a great discussion. I think we've talked a lot about sort of the different elements of why COVID-19 is important as far as heart and blood vessel conditions are concerned, what to do if you develop COVID-19 and how to prevent developing a heart-related problem. If you have a history of heart disease or blood clots, what does that mean if you were to get COVID-19? And then, of course, probably one of the most important topics right now is what's the number one thing we can all do to help sort of control this pandemic, which is wear your mask and get your vaccine. So I think we've really covered quite a breadth of information here in this hour.
I think so too. Anything to add, Dr. Bhave?
I just want to say that I think, as spring is coming, I think we are starting to see the light at the end of the tunnel here. This has been a really long, hard, difficult year, but it's also been amazing to see how our medical community and our patients have rallied to protect themselves and each other, and to eventually beat this virus in many different ways. So I want to say just thank you to my colleagues and my patients for all the great work that you're doing.
Thank you, Dr. Bhave. I think that's a fantastic way to round out today's chat. I thank you to our viewers, and certainly thanks goes to Dr. Barnes and Dr. Bhave, our experts who answered a very broad range of questions here today. So thank you both, and have a good afternoon.
Thank you so much.
Thank you. Bye-bye.